Live sound check, presenter's laptop. Live sound check, clerk's laptop. Good afternoon, everybody. Welcome to the Emergency Community Services Committee meeting. I'd like to call this meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and the media may be also audibly or visually recording this meeting, and all electronic devices are to be switched off to a non-audible function during committee meetings. Members are reminded of a 5-minute time limit, which will be adhered to during this meeting. Members can submit another request to speak if they require more time to ask questions or make comments. I'll now proceed with a roll call. Please indicate your presence when I call your name. Councillor Clark.
Yes, I'm here. Sorry.
Good afternoon, no worries.
Couldn't find the button.
Councillor Jackson.
New Madam Chair Nan, I am here.
Welcome. Good afternoon. Councillor Marula.
Good afternoon, Madam Chair.
Good afternoon. Councillor Pauls.
And I'm here. Thank you.
Good afternoon. And Councillor Whitehead. Okay. First item on the agenda is ceremonial activities. I'd like to call upon Chief Michael Sanderson to introduce a video for a ceremonial activity this afternoon.
Thank you very much, Madam Chair. Madam Chair, members of committee, I recently had the privilege of accepting a check in the amount of $20,687 from Steve Pinella, who's acting on behalf of the Firehouse Subs Public Safety Foundation of Canada. These funds will provide the equipment and the training to establish a paramedic bike team, which will be helpful in allowing us to provide earlier paramedic care in situations involving large crowds and special events. I'd also like to thank the in-person recognition that's unable to happen, giving thanks as well to Cindy Sordas and her entire communications team for doing such a great job in creating the video, which we are now able to share with you. So thank you very much, Madam Chair, and if Madam Clerk could roll the video.
There we go. Excellent. Just bear with us at the moment. We're having some sound issues on the video.
The Hamilton Paramedic Service and the City of Hamilton are very pleased to receive this grant from Steve Pinella and from the Firehouse Subs Foundation for the City of Hamilton to receive a $20,000 grant to support Hamilton Paramedic Service in a new initiative. So, Steve, thank you very much for being here.
Oh, absolutely. It's my pleasure. I mean, this is what the Public Safety Foundation of Canada is all about, and I'm glad we could keep the funds here in Hamilton. You know, Public Safety Foundation just this fall approved over 10 grants in excess of $220,000. Since 2015, we've donated over $1.2 million, and all within the province of Ontario. So that's what this is for, and I'm really glad we were able to take advantage of it. So thank you.
Great. Thank you very much, Steve. Steve is the owner, of course, of the Firehouse Subs restaurant that's very close to our location here.
Oh, seems like the video stopped playing just as Chief Sanderson was introducing the Firehouse Subs restaurant. Okay, we're gonna try it one more time, 3 times the charm, right, folks? Bear with us one more time. Fingers crossed, right?
Steve, tell me, giving back to the community is at the heart of the Firehouse Subs brand. During the first wave of our pandemic, Steve and Firehouse Subs donated wonderful meals. I have to tell you, our paramedics greatly appreciated receiving the meals to sustain them through some of the very difficult days in the first parts of COVID. Very much appreciated from their activities. And I know that Firehouse Subs has also supported through their foundation the Hamilton Fire Department. They've provided smoke detectors and the smoke detectors for the residents in the city of Hamilton, and they've provided a drone to assist them in their search and rescue work. The Hamilton Paramedic Service will be utilizing these grant funds for the establishment of a paramedic bike unit, something our service has not had, but we're going to greatly benefit from. A paramedic bike unit will be able to reach patients much more quickly, particularly in mass gatherings like Supercrawl, the Festival of Friends, and other areas where we end up having challenges because of crowds and road conditions, to be able to access patients quickly. With the agility of a bike, our paramedics will be able to quickly access patients that are in difficult to reach areas and begin providing prompt emergency care. We anticipate having the paramedic bike unit active by early 2021. In these times that are more challenging than ever before, we're very appreciative of our community partners like Steve and the Firehouse Subs Public Safety Foundation for supporting us and continuing to deliver the quality of care that the residents in the city of Hamilton expect and deserve. Thanks to Steve and the Firehouse Subs, the Public Safety Foundation of Canada, and the Hamilton Paramedic Service is now going to be better equipped to keep all of our communities safe. So thank you very much, Steve.
Chief, thank you very much.
We have a wonderful check here in the process. $20,687.68. Very much appreciate this on behalf of the City of Hamilton and the Hamilton Paramedic Service. And Steve, as a token of our appreciation from the Hamilton Paramedic Service, I'd like to give you one of our coins to recognize the work that you've done in support of our service. And on our coin, we look at our motto and the things that we try to care for. It's the caring, the compassion, the commitment, the confidence, and the courage. So, Steve, Thank you very much for your work on behalf of the Hamilton Paramedic Service.
Chief, thank you very much. This means a lot. I appreciate it. Thank you.
Thank you.
A big virtual round of applause.
Thank you very much, Madam Chair, and I'm glad that I didn't have to try to remember all of the things that I said in that seeing I was not wanting to go through a voiceover, I didn't think so. Thank you very much.
Thank you so much, Chief. And I'm sure with all of my colleagues joining me, we definitely want to say thank you to the Firehouse Subs and Public Safety Foundation of Canada for your generous donation towards much needed paramedic services that will serve the needs of our residents across the country. So thank you very much. Moving forward with the agenda, next is approval of the agenda. Madam Clerk, are there any changes to the agenda for today?
Yes, Madam Chair, there are changes to the agenda. Under item 6, delegation requests, we have item 6.1, Senator Rose Thomas, respecting the homelessness rate for a future meeting. And then we have under item 10, discussion items, we have a new item 10.9, adaptation and transformation of services for people experiencing homelessness, update number 2. That's report HSC 20B citywide. And item 10.10, Ministry of Municipal Affairs and Housing, MMHAH, Mental Health and Addictions Funding, report HSC 21006 citywide.
Thank you very much. May I please have a mover and seconder to approve the agenda as amended? Moved by Councillor Paul, seconded by Councillor Jackson. Any discussion on the agenda items as amended? Okay, moving along. We'll now require an electronic vote to indicate your vote. Thank you, and that is carried. Moving on. Declarations of interest. Are there any declarations of interest at this time? Seeing none, we can move on to approval of the minutes of the previous meeting. Item 4.1, December 10th, 2020. May I please have a mover and seconder to approve the minutes from the December 10th meeting? Moved by Councillor Marula, seconded by Councillor Clark. Any discussion on the items within the minutes? Seeing none, it's time for an electronic vote. And that carries. Moving on to communications item 5.1, correspondences from Phil Graham, Assistant Deputy Minister, Early Years and Childcare Division, Ministry of Education, respecting childcare updates. May I please have a mover and seconder to receive item 5.1? Or if there's any questions, first we can get a mover and seconder to get it on the agenda. Moved by Councillor Paul, second by Councillor Jackson. Any discussion on this item? Okay, we'll require an electronic vote, so please indicate your vote now. Bear with us a second. The vote's coming up. There we go. And that carries. Moving on to item 6, delegation request 6.1 is before you. Senator Rose Thomas, respecting homelessness rates. May I please have a mover and a seconder to bring this onto the agenda? Councillor Marula and Clark. Any discussion? Seeing none, moving over to an electronic vote for future meeting. There we go. And that carries as well. Moving on to consent. Item 7.1, Seniors Advisory Committee meeting minutes for January 3rd, February 7th, and October 2nd. Moved by Councillor, oh, fair enough. I've been informed that we're going to vote on all of the consent items together. So we'll keep Councillor Jackson as the mover, and then we'll get another seconder for the consent items. Second item is 7.2, menstrual products pilot, report HSC 20001A citywide. And item 7.3, the residential care facilities liaison second quarter update. So moved by Councillor Jackson, seconded by Councillor Clark to bring these items on the agenda. Are there any items that committee members would like to discuss? Councillor Clark.
Thank you, Madam Chair. I just want to thank staff. I was very pleased to read the residential care liaison report. I recognize that we're only into I think it's now the second quarter of the pilot. Is that correct, Mr. Johnson?
Through the chair, yes, it is. This is the second report we're bringing forward.
So I was very pleased with the report in terms of seeing the impact that it is having. My only chagrin is we have to somehow publicize it more. So I have a question to Mr. Johnson in terms of how are we promoting the existence of the residential care facility liaison office to the general public?
General Manager Johnson.
So through the chair, at this point, for the general public, not a lot of publicity around this is occurring. This was targeted more towards residents, their relatives, and caregivers at this stage. But I can tell you that our conversations now we're halfway through this first year pilot. So what does the future look like for this, and how will we combine some other complaint lines that exist within the RCF system and make this a more robust and all-encompassing type of approach, as opposed to what Ricky Frith is doing in terms of her role, what public health or MLE are doing in terms of their roles, because there are other numbers that people can call with concerns about the RCFs that existed prior to this pilot. So to your direct question, I think that we were seeing how this would work with those more immediate people that are impacted, residents and their caregivers in that network. And then we'll look at how this can also be expanded in terms of where people go for other general concerns about RCFs in general. And that would be part of what happens after this first year of the pilot.
So are we promoting this then at the residential care facilities, and are the owner operators of the residential care facilities cooperating with the promotion of the program?
Yes, so through the chair, it was a requirement that this is placed in a prominent location there. I know it is being through word of mouth and through community support organizations also being communicated to, and where we are finding that there's a good degree of compliance with this. So we're not going in with a specific inspection regime just for the poster, but when we're in there doing our inspections in general, we make sure that it's there. So we would have now had a chance to get through most of them. And if it's not in a prominent location, we have that rectified. And for the most part, we're finding out that it is. And you can see by the increasing numbers. So if you looked at this report versus last report, and these are predominantly from residents or their immediate support people. So we are seeing more and more use of this. And I would say that while Ricky did include a paragraph that talked about a lot of the other concerns, some of which were from the public in general about RCFs, there are very specific things that allow us to then send in the very specific inspectors we need to address the situation. And as you can see, in most cases, they are resolved without charges being laid. A couple of the ones that are a little more complicated are the ones that right now are having their licenses revoked. And so that's a whole other kettle of fish. So I will tell you, 6 months into this, this is moving along better than I anticipated, to be quite honest, in terms of both the quality of the concerns that are being raised. So they're specific and things that we can follow up on and affect change, but also the general usage of it is excellent.
Well, Madam Chair, I'll just wrap up. I had tremendous faith in our staff when we brought this forward that they would be implementing it wholeheartedly, and they've done a tremendous job. And I expected that most operator owners, they may not like it, but they're going to cooperate with it, because at the end of the day, it's improving the service to all of the residents who are living in congregate living in these residential care facilities. So I'm very pleased so far, and I'm hoping that the trajectory continues, and the RCF liaison person really does help to become an advocate for these residents who have challenges either speaking for themselves or speaking for their loved ones with the owner operator. There's a power imbalance, and the city of Hamilton corrects that power imbalance when it's our liaison officer intervening. So I'm thrilled, Mr. Johnson. So please share my gratitude with your staff for such tremendous success so early on.
Well, thank you very much. And through the chair, Ricky Frith is on this call, and Ricky has done a tremendous job. And I just want to let folks know that she's also been thinking about the future of this. And so she is convening conversations with our colleagues in public health, with municipal law enforcement, and with folks in the community who care about residential care facilities. They may not run them. Some of them are organizations that refer to these as a way of understanding how to do this better in the future. So I believe we're affecting positive results as it is today. But Ricky, in her typical fashion, is making sure that she has these broader conversations so that when we bring back our recommendations for how this will move forward in the future, it will not just simply be how we continue it as is, it's how we make it better. So I thought I'd share that with you, Councillor, because I know you were behind the initial pilot, and we thank you for this opportunity.
No, thank you very much.
Thank you, General Manager Johnson, Councillor Clark, for raising those important points. Any other councillors on items 7.1, 7.2, or 7.3? Seeing none, I will add myself to the list. I did have a question, and I'll turn the chair over to Councillor Pauls.
Go ahead.
Oh,
Thank you.
Councillor Clark, my apologies. Councillor
Oh.
Clark is my VP, so I pass it over to him.
Happy to be your VP.
Thank you. I'll
Go ahead.
VC, technically. There you go. There you go.
I've never been a vice principal, but I'm looking forward to it. Go ahead.
Well, schools are opening on Monday. There you go. Pinch it somewhere. Through you, Vice Chair Clark, to staff on item 7.2, the menstrual products pilot. So just to clarify that the initiative that the city is pursuing that will pick up in Q1 of this year is a tandem program operating both approaches of the universal approach at the rec centers as well as the targeted approach through the food banks. Through you to staff.
Who wants to tackle that?
I'll take that. It's Grace Mader with Healthy and Safe Communities. Councillor, through the chair to the councillor, yes, it is both approaches. We're hoping that as we move through the first quarter and into the second quarter, as rec centers also reopen to the public and that, but the food share is all up and ready and raring to go on this pilot, and they've been an incredible help to us on it. So they're really excited about the opportunity.
Excellent. Through you, Vice Chair Clark, to Director Mader. So in terms of the universal component through the rec centers, the availability will be only when the rec centers are open and outside of lockdown, correct?
Through the chair, yes, that's correct.
Okay, thank you so much. Those are my questions, and I'll take back the chair. So we're at the point where we can receive. So it's moved by Councillor Jackson, second by Councillor Clark. Electronic vote once it is up. Thank you. There we go. Excellent, and that carries. Moving on to discussion item. Item 10.1, Macassa Lodge Redevelopment Project Report. May I please have a mover and a seconder to place the item on the agenda? Moved by Councillor Paul, seconded by Councillor Jackson. Any discussion items on this agenda item? Councillor Jackson?
Thank you, Madam Chair Nan. I didn't know if the new ward councillor, who has inherited one of our two fabulous long-term care facilities, would like to speak first, but I definitely would like to say a few words as well in support of this recommendation. Thanks, Madam Chair.
Fair enough.
And yes, and thank you, Councillor Jackson. I have to thank Councillor Jackson because I remember when I just got elected, he told me the sad thing about changing of the boundary was that he was going to lose Macassa Lodge. He loves it so much. And I want to tell you, Councillor Jackson, I'm so glad. I am so glad that together we can make Macassa Lodge the best long-term care here in Hamilton, and it could be a model for Ontario. So I want to thank you for that. But when after you speak, I would love to approve that recommendation and to move the report 10.1. And I would love it if you second, and then I could speak a little bit more just after that. So thank you.
Okay, thank you, Councillor Paul. So it's moved by yourself and seconded by Councillor Jackson. I got that edit. And then Councillor Jackson, you're second on the speakers list. And just a reminder to my colleagues to please use the eScribe icon so that we can keep the speakers list clearly in front of us. Thank you.
Thank you, Madam Chair Nan, and thank you, Councillor Pauls, for your kind words. And I know one of our two fabulous LTCs between Macassa and Wentworth Lodge in Dundas, but specifically Macassa now in your new Ward 7, is in wonderful, capable, compassionate hands with you in your office. Madam Chair, I just like to, I think for public consumption, it's important, especially in light of what has been exposed during the last 10 months of the horrendous pandemic, that we get some comments as to this recommendation from staff, either from General Manager Johnson or our Senior Administrator, Holly Diardi, just so that for those viewing in on our virtual meeting, this is to hopefully, this is step one of a two-step process to at least give staff the authority today to apply to the Ministry of Long-Term Care for an allocation of funding for 20 new beds as part of a bundled package of overall 64 beds that will be both newly built and or renovated. So that's number one, 64 beds. We currently have 44 in the D wing. And by the way, that D wing, Madam Chair Nan, my apologies. Am I picking up a little bit of echo? I'm sorry. Oh, thank you. Okay, my apologies. I didn't think it was from my end. Sorry. So the current D wing of Macassa Lodge, Madam Chair, the current D wing here that was built in 1956, refurbished to some degree in 1988, the last time any renos were done to the D wing. That's the wing that we're hopefully eventually, with appropriate funding, going to demolish and build a new over here near the City Housing Hamilton complex along Macassa Avenue, a brand new B wing, which will house the old 44 beds built new, along with 20 additional beds to give us a 64 bed wing. So that's all potentially positive news. Of course, the cost that's listed in the report is estimated at 27.7 million. We've already heard from staff that the province, Madam Chair, is going to offer up to some form or degree close to $6 million. The capital budget 2 years ago that council approved in this term has allotted $4 million. So obviously we're going to be in a shortfall range of around $15 million at this current time. But when I said that this is step one, hopefully today, hopefully with committee support and council's ratification next week, this will allow staff to apply to the ministry. And then if all goes well with our application and approval, step two coming forward in the spring or summer by staff will be a financial strategy of how to fund any shortfall. So Madam Chair, with all that said at the beginning, through you to either Paul or Holly, what will be the benefits overall, Paul or Holly, in terms of building this brand new B wing eventually with the additional 20 beds? But what will be the overall benefit in terms of new standards, extra spaces for staff and our frail elderly residents, etc.? Through you, Madam Chair, please.
Thank you. Will it be Paul or Holly answering the questions? And also, while we get them live, Councillor Jackson, you're hired for visual aids and education for the committee.
Oh, thank you. I think that was a compliment. Thank you.
It was super helpful.
Thank you.
Holly, please go ahead.
Through the chair, thank you, Councillor Nan. So the D wing has been built in 1954, and as Councillor Jackson has shared, it was renovated in 1988. But we know that the design standards has significantly changed from that time of original build. And so we are challenged at times with particular admissions. And so through this process, we would be able to expand for accessibility issues for many more residents, increase acuity for residents that are coming in. And with COVID that's hit us in the past 10 months, it's an opportunity to redesign with COVID in mind in how we minimize impact of infection control issues that happen across the long-term care sector.
Very good. Thank you, Senior Administrator Odiarty, for that commentary. So there's just some, Madam Chair, of the benefits of having a brand new eventual B wing. Obviously, I'm hoping that there apparently is a quirkiness with the existing 44 beds in terms of the eligibility, Madam Chair, with the province and provincial funding. But we'll do our best to work through that. Staff, I've got a multi-departmental team that is working on this. I said last week, and I'll say it again for the public record, let us strike while the iron is hot. I believe, at least amongst my constituent, Madam Chair, my constituents, there is no more opportune time than now, given what's sadly been exposed mostly in the private sector with long-term care facilities. There's no better time than appealing to senior levels of government to upgrade, modernize, and provide better facilities and better annual care with more PSWs and nurses from an operating standpoint for our long-term care facilities than ever before. And so I'm strongly supportive, seconding Councillor Paul's motion for this report. And I thank Holly and her multi-departmental team for all they've done the last few months to bring this forward. Thanks for your indulgence, Madam Chair Nan. Thank you.
Thank you, Councillor Jackson. Moving to Councillor Pauls, please.
And thank you. And I also want to thank Holly and her team for this ongoing steadfast work to our LTC Macassa Lodge. I really want to thank you for that. And before I put the motion through, I want to ask you, Holly, since our building is so old, is there a study that says the older the building, the more contagious, like we've had more long-term care people with the virus because of how old they are, and what are some of the reasons?
You'll need to unmute yourself, Holly. We can't hear you right now.
Thank you so much.
Thank you.
Through the chair to Councillor Pauls, there has been information gathered from a number of sources in regards to long-term care. Through our professional association Advantage, they have gathered data that indicated that 59% of long-term care homes that were 30 years and older have fared worse throughout this pandemic. The older long-term care facilities, Councillor Pauls, typically had anywhere from 4 to 8 bedrooms in them. At Macassa Lodge on D Wing, we had the whole unit is ward rooms with 2 people in a room and a shared washroom. And so again, through the information that we're finding to move forward, we would want residents to be in private rooms and perhaps with shared washrooms. But we really need to have focused attention while we have this opportunity to mitigate any type of infection control risk while we are planning to develop a new B wing.
Thank you for that. And Councillor Jackson is absolutely right. While the iron is hot, while the attention is on our older building, we need to pursue this. But I want just the committee to know that this approval today does not recommend the approval of financing. We're just approving the resolution to allow staff to confirm the Ministry of Funding allocation to this at this time. Is that true?
Through the chair, that's correct, Councillor Pauls.
So I just want to make sure we move it, and I'm so glad the resolution will be coming in May and June to a follow report. And also in April, we'll have the DC study has been completed and approved by the committee to council, right? We'll have the DC study done as well.
That's correct. That's my understanding.
Okay, thank you. So I would like to now move the report 1001 and seconded by Councillor Jackson.
Thank you, Councillor Pauls. The next on the speakers list is Councillor Clark.
Okay.
Thank you, Madam Chair. I was listening intently and Holly described our facility as having, I think it was 2 beds in 1 unit, but they're separated. That's what we have in Macassa.
Through the chair to Councillor Clark, on D wing, we have
I apologize, Holly, for interrupting you. If you could just pause for a second before responding. Councillor Pauls, if you don't mind muting yourself to avoid any background noises so we can hear the response clearly. Thank you. Go ahead, Holly. Thank you.
Through the chair to Councillor Clark, on D wing, we have 44 rooms. All of those rooms are ward rooms, so there's 2 residents sharing that room, and additional to sharing a washroom.
And so the intent of this is to add, I believe it was 20 beds. Will they be single? What do you, I guess you call it private?
Through the chair, it would be single rooms, and we're looking
Yes.
at having shared washrooms.
And is there any program available to us currently that you know of that would enable us to retrofit the rest of, I think D wing, I guess you called it, where there's 2 in a ward. I know St. Peter's residents at Shidok, they kind of separated the 2 out by basically a wall down the middle somehow. I'm not sure if that's possible. I'm just asking because in terms of dealing with future infectious disease, private rooms are vitally important in a long-term care setting.
Through the chair to Councillor Clark, currently the size of the room and the current design standards are smaller than what we need them to be. So to add an additional wall would not allow staff to have the correct mobility to support the residents in these rooms.
And so are we exploring the ways to move towards private rooms in the future, given what we've just experienced with COVID-19?
Through the chair to Councillor Clark, that is what we are trying to do with the new B wing. That's correct.
Super. I fully support that, Holly. I think it's really important that we learn from what we've now experienced and how do we now design and create a setting that is friendly, livable, very personable, but also protects the residents from such infectious disease. So thank you very much. I appreciate that.
Thank you, Ollie, for helping clarify those questions. And if there are no other speakers, the vote is before my committee colleagues. The recommendations is 2 part A and B, and the vote should be up for your consideration. And that carries. Thank you to my colleague. Moving on to item 10.2, Hamilton's Community Safety and Wellbeing Plan Report HSC 19032A. Any of my colleagues have any questions? Oh, sorry, I guess I need a mover and seconder to put it officially on the agenda. Moved by Councillor Marula, seconded by Councillor Pauls. Any discussion items? Councillor Jackson, thank you.
Thanks, Madam Chair. So this is Hamilton's Community Safety and Wellbeing Plan. And I think General Manager Johnson, if you could please, given all the publicity over this plan, given a number of concerned individuals, groups, some of the protests that we've seen in our city, feeling that more could be done for those that need more attention, whether it's in mental health, whatever it might be, and other social services. And as you know, Hamilton Police Service, where many in our community may have not realized until Chief Kurtz spoke to council last fall, may have not realized the Hamilton Police Service's involvement up to now and their partnership with this Hamilton Community Safety and Wellbeing Plan. Maybe, Paul, just a status of where it stands, what's happening, and I specifically want to get into page 3 of next steps and community engagement. Through you, Madam Chair, please, to the General Manager for maybe some update and comment.
Sure. Through the chair, I'll begin with some comments, and then I'm going to ask Grace Mader to give you the latest in terms of where this group is moving and next steps. She is helping to continue to ensure that this doesn't lose the momentum between now and June when this needs to be approved, while we also fight the pandemic and all the rest. But at a high level, what you've talked about, this is a plan that would set out for Hamiltonians ways that we can better address some areas of community safety and well-being. And it starts with the conversation that we've been having with the community about what safety means. And so we were very intentional to start with not a definition that a few people came up with, but we've actually engaged the community around what safety means. And from there, look at specific areas that is a known room for improvement, and we can tackle areas where there are large numbers of people. And so we'll be looking at issues that have to do with homelessness and extreme poverty. We'll look at issues to do with racism and hate in this community, and also look at particular populations for whom the programs themselves may not offer the same level of safety and support that we want them to, and what can we do to help that out. So that is the overall goal of the plan in its fruition. But I'll ask Grace to give you a firm answer in terms of some of the next steps that this group is taking at this time.
Thanks, Paul. Through the chair, Councillor Jackson, we're looking at, currently we're meeting one-on-one, myself and Jennifer Hohol, who's helping us with this, meeting with each of the members of our committee at the present time to really tap into how they can help us reaching out into their networks to ensure that we're hearing from the right voices and making sure that we're having a broad engagement strategy. We know engagement through this virtual time can be very challenging, and we're very cognizant also of that there's somewhat of a fatigue factor as well out in the community. So we're really wanting to tap into where those folks already have some interest and already have some commitment to, and hear from them. We've got a very engaged table to help us with this. Through our communications officer, Aisling Higgins, we've developed a communication strategy that will also be putting into place as we move along this trajectory. And we're also very aware too that we want to make sure that when we bring the report back to committee and council for review, it has a broad enough engagement that you're feeling comfortable that the community has had their ability to be involved in it and have some input to it.
So General Manager Johnson, firstly, thank you, Madam Chair, and Director Mader, thank you for that further elaboration on community engagement, and you've raised my comfort level enormously, and I get the restrictions of the pandemic, that the in-person typical town halls, face-to-face, round tables, everyone in the physicality of each other isn't possible. But I just want to make sure, beyond a shadow of a doubt, Grace, as much as we can, near perfection of civic engagement, as much as we can get close to it, Madam Chair Nan, whether it's mental health, youth at risk, poverty, homelessness, racism, whatever it is, the topics of the day, I don't want any Hamiltonian at the end of this process to say, geez, if we had known about the Hamilton Community Safety and Wellbeing Plan, we would love to have been a part of it and participated and contributed towards it. So, Grace, I've heard you that as much as possible, you've provided a roadmap, a plan of as much civic engagement as possible. All I would say to you is you've got my full support to even expand upon it if you need to, and not worrying about budgetary pressures, whatever. If you do, I would suggest, Madam Chair, bring it back to this committee, because I want every Hamiltonian to feel part of this. And and the outcome of it that'll be successful and making sure it's inclusive for everyone. Thank you, Madam Chair, Nan.
Thank you. Moving on to Councillor Clark. Councillor Clark, you're muted. There
Yep,
we go.
sorry about that. Thank
No
you.
worries.
So what's before us is excellent, given what we're dealing with COVID-19. I have to share some similar trepidations to Councillor Jackson. And if I may, Madam Chair, I'll speak to my ward. I know it very well. 3/4 of my ward is rural. They do not have internet access unless they have satellite. Satellite internet is very expensive. Very few of my residents have it. Moreover, just shy of a quarter of our residents in Ward 9 are poor or working poor. Internet in my ward is expensive. It's not cheap. So I'm concerned that while we're doing this fantastic outreach through social media and we're having it through virtual town halls and all the rest of it, we're missing a whole lot of people because there is no in-person gathering where they can come out and speak. On top of that, we have an awful lot of people who are receiving services who are struggling, whether or not they have mental health issues, addiction issues, or whatever the case may be, and they may have concerns about police and safety in our community, but they may be living in a residential care facility, they may be living in a boarding house, and again, they don't have access to the internet. And so how do we gather or encourage civic engagement to all those residents in wards across the city, not just mine, who have no access to the internet?
Thank you for your question, Councillor Clark. Which staff will be taking that on? Is it Director Mater?
Thanks through you, Madam Chair. Councillor Clark, you raise a lot of really good issues, and those are things that we have been discussing as well. We also see this as just the start of the engagement through this period of time. Our plan is going to be at a very high level, and that the true work will be when we develop that implementation approach to it as we move through the summer, the fall, and ongoing. So we really believe that there will be this is just the start of that journey, and that there will be a lot of opportunities along the way for folks to be included in what is important to them. It's not just setting those priorities at this point in time. It's trying to evolve that as we move through the next number of months and years also. We also know that a lot of folks that have involvement with some of our agencies, that's where we really want to reach out to service providers that know the people that they're serving, that know where some of those challenges lie, that their voices can be heard. Hopefully that's another avenue that they can be heard.
Thank you, Councillor Clark.
Okay, but I'm not hearing how we're going to reach out to folks who don't have internet access. In the past, in the old days, before we had internet, we'd be doing mailings and inviting people to fill out a survey and send it back in, all those types of things, because we didn't have access to the internet. Can we, I mean, because my understanding is we're on a clock on this program. The government of Ontario says you have to have this program basically up and running within a certain period of time. So can we not look at certain areas of the city and target certain areas of the city and mail out surveys? So the rural areas where they don't have internet, send out a survey there. All of the affordable housing complexes, we know where they all are. Those are all people that are struggling to pay their bills, let alone $100 plus internet access a month. Can we not mail surveys to them? That's the kind of thinking that I have, because I don't know how else we're going to reach out to these people. And I'm with Councillor Jackson. I fear that we're going to be finished this and people are going to be saying, I didn't know anything about it. You didn't call me. You didn't email. I didn't get any emails because I don't have email. And we get those criticisms. So I'm trying to squelch that before it happens. How do we fix it before it happens?
Through
Thank
you,
you,
Madam
Dr.
Chair. Absolutely, Council. We'll be looking at those different avenues for engagement and, information mail outs through the paper, through some of those more traditional methods as well.
And I would caution you on the paper because I'm hearing from an awful lot of people that they're not seeing anything in the newspaper because they don't have a subscription. So again, the old paradigms that are in our head where this is how we usually spread the word, it's not working today. It seems to have changed. People aren't relying, and I worry about our future because I really worry about the loss of newspapers. But I'm watching this Spectator and the Stony Creek News shrink in terms of actual paper, lots of advertising, not a whole lot of content, and people are not getting subscriptions to the Spectator like they used to. So I'll leave it with you. I'm hopeful that I'll see something in the future that we're actually mailing out survey questions to different areas of the city to make sure that we're hitting people who do not have access to the internet. And I'll leave it there, Madam Chair.
Thank you. And I don't see anybody else on the list, so I did have a couple of questions also, and turn the chair back to you, Councillor.
Go ahead. You have the floor.
Thank you. So thank you, staff, for this update. And a reminder to all of us in the public is that we need to turn in the high-level response back to the province in July 2021. We received a 6-month extension in consideration of COVID's hindering many municipalities from being able to get this done. And our current strategy right now in terms of next steps is going to be this communication and engagement strategy. And I was just looking at the Engage Hamilton link that is associated to the report and some of that consultation. And I read in the report that there is those areas of emphasis and priority around hate-based incidents, violence, mental health and stigmatization, substance use, homelessness, and access to affordable housing and access to income as being kind of the local priority areas that the advisory committee has identified. How will those priority areas be linked to public input? Because what I'm seeing on the website to date, which I love seeing the kind of summary comments fed up in real time so that residents can see what other residents are talking about. But I was just curious from that perspective how we are going to reconcile the two, given that there are some very pointed priorities for this work.
Who wants to tackle that one?
Through you, Madam Chair, the priorities as it's outlined in the report, are those big buckets, and those will be the starting point for some of those the input that we're looking for to have. We also know that there's a number of community partners have also invested with a lot of different priority settings as well, and that we're going to be looking at trying to combine some of those efforts as we move along. I'm also going to turn to Jen Hohol. Jen has been leading the discussion about the engagement, just to have her weigh in on this.
Thank you.
Hello, it's Jen Hohol here, Senior Project Manager. Through the chair, what we will be doing, what you see on Engage Hamilton, it was a site that was started in mid-November. So we wanted to keep the questions very high level at first. With the expanding our engagement opportunities, we're going to now start talking about the priorities in some of these virtual engagements. So you'll see the Engage Hamilton website shift to help dive in a little deeper into those priorities. So over the next week or so, as we finalize what the questions and the conversations will be in the engagement sessions, you'll see that mirrored in some of the Engage Hamilton and new questions on that site.
Thank you, through you, Chair. I guess so the second iteration will give folks an opportunity as residents to hone in on those priority areas and give us the kind of feedback we're looking for to substantiate those priority areas and what our recommended plan of action could be moving forward. I have a question through you to staff about are we also, from a high level at the advisory committee level, looking at best practices regarding community safety and well-being that other municipalities have either implemented or are already integrating into their reports? What does that cross comparable municipal sector look like in some of this work? Understanding and recognizing we are looking for something that meets the specific needs of our Hamiltonians.
Through you, Mr. Chair. Yes, we've been doing that. We've been engaging with some conversations with other municipalities to learn a lot. There's been a number of municipalities that have completed their plans. The majority of them are in the process at the same point as we are. And so through some of our provincial networks, we're keeping abreast of how other communities are approaching them, as well as how our priorities are aligning with other areas as well. So we are making those comparisons.
Thank you. And final question through you, Chair, is earlier in the fall last year, the Ward 3 office kicked off a series of community meetings in response to the issues that had been surfacing through the pandemic and also had existed prior to the pandemic, but became so much more urgent among neighbors. And they did kind of correlate along these areas. And we, thanks to many staff members, yourself included, Director Mader, joined us for the housing and homelessness one, and we had one on health and emergency services. We've had one around street level safety as well. And our final one is going to be on community resilience. We've been keeping track of the data that our residents have been informing. We wanted to make sure that we got clear as a Ward 3 office what the concerns are, but also to hear very specifically from residents about what their ideas are moving forward about how we can address these issues. Is there an opportunity for any ward councillor office who may be engaged in this process of engagement to pass that information along formally into this process?
Through you, Mr. Chair, absolutely. That'd be fabulous. Any kind of that information. A lot of what we're doing is the data gathering and trying to tap into all those different avenues where that information may be already in existence. So that'd be perfect. We will reach out.
Excellent. I'd be happy to pass that along. Okay, I'll take back the chair if there's no other questions. No other speakers. There we go. Okay, so we had a mover and a seconder to put the report on the floor. So we're at the point where we need an electronic vote to receive it. Thank you. And to staff for answering all the great questions on that. And that one carries. Moving on to 10.3, Municipal Affairs, Housing, Social Services Relief, Phase 2 holdback. May I please get a mover and seconder to put the report on the floor? Moved by Councillor Pauls, seconded by Councillor Marula. Any discussion on item 10.3? Seeing no speakers, the report is before you for an electronic vote. And that carries. Moving on to 10.4, encampment update. Moved by, I apologize, just need to toggle here so I can see my colleagues. Moved by Councillor Jackson, seconded by Councillor Clark. Any comments or questions on the encampment update report? Seeing none, we'll be voting to receive the report. Also carries. Moving on to item 10.5 of the United Nations Special Rapporteur's report on National Protocol for Homeless Encampments. Can I get a mover and a seconder to bring this report onto the agenda? Onto the floor, sorry. Moved by Councillor Marula, seconded by Councillor Pauls. The report is before my colleagues. Are there any discussion items? Seeing none, I did have a couple. If I may turn the chair over to Councillor Clark.
Go ahead, you have the floor.
Thank you. First of all, I wanted to say thank you to staff who took the time to do this thorough analysis of the report. I think it was tabled earlier in 2020 in the summer when we were in the height of the encampment kind of growth and visibility in our community across the city, and a pretty robust conversation publicly with our residents and across the table about how we ensure that our homelessness strategy, and specifically how we're dealing with those individuals who are facing houselessness, is done so with a human rights lens, and making sure that we're taking some of the guidance that came forward in the shape of the principles that were outlined in the UN report into consideration as a municipality as we move forward in evolving our encampment strategy. So I did want to give this opportunity, if it's appropriate and my colleagues will allow it, to ask the staff who are responsible for the report to give a high level. I think the pieces that I'd really like to bring onto the public record are itemized in the grid, starting on page 3, moving on through till page 7 in the report, speaking to how we are localizing our approach and what the considerations look like for those principles. I think there's some really innovative information here, but also helps publicize the way in which our city services have been working with our colleagues and counterparts and our agency partners to date around encampment. So if I could, through you, ask staff to provide that, please.
Mr. John?
Thank you and good afternoon, councillors. Edward John, Director of Housing Services, and through you to the councillor. Yes, this was a report that we've provided in terms of alignment with the Raconteur report as a best practice guide, and I think as you mentioned throughout the report, I think you'll see where we have those points of connection. The ultimate goal being a human rights-based approach where we prioritize that of the individual in all our dealings with encampments and houselessness in our community. So I think it serves as a continual effort in terms of how we engage, how we respond, and how we maneuver within the expectations both of the community, but also the available services that we have. As you may be aware, obviously our engagement has been increased and enhanced through the process and the pandemic of COVID, and informed through the agreement that was reached through the injunction. That has been assessed here in the report, and ultimately where we are directing towards is an alignment that is it's great to share with everyone. I'm not sure if there's any particular questions. I know the matrix that is provided in the report goes itemized through the expectations and guidance that is provided, and certainly you'll be able to see where there is those points of connection.
Thank you. Through you, Chair. Yeah, so what was really valuable for me to see is, because I've had an opportunity to work closely with staff as we've been dealing with the encampments in Ward 3 and the regular kind of communication and updates that we've been able to have with the multi-sectoral table, who has been responding to the needs of those who are homeless and experiencing homelessness. I have a clear sense of the way in which the team is committed to the work that's unfolding and the ways in which it's unfolding versus some of the critique that we've heard in the community about I guess maybe not being quick enough in our compassionate approaches. And so I really want to just encourage residents to read this piece. I did want to highlight that the report that's before us speaks to the need to integrate the language, I think on page 6. Sorry, I'm just shoveling through my notes here. Page 6, as a housing services division looks to adapt and organize both short and long-term considerations for encampment response, we may be able to use this report essentially to inform our community-based response and actions moving forward. So from that perspective, through you, Chair, a question to Director John is, you use the word may versus will, and I was just curious about why the may was there.
So through the chair to the councillor, the may is just depending on the actions that derive through some of our protocol discussions, but it's also recognizing that many of the aspects raised here are guidelines, and it's not necessarily binary. So there's not a yes or no. There's a maybe we're 70% towards achieving that end goal. Maybe it's 80%. So it's a constant fluid process in which, through that engagement approach, we want to be flexible in terms of the successes that we achieve and the outcomes that we achieve. So Like I say, this is a resource to which we align ourselves with. We feel confident, we have met the intent, in that process, and as demonstrated within this report, we continue to improve and engage our processes as best we can.
Thank you. And through you, Chair, in terms of next steps in that approach that is evolving, given the thoroughness of our experience right now as a municipality, in page 6 and 7 of the report, in terms of the equity considerations and approach, there was a lot of emphasis in the report about needing to hear from people with lived experiences and helping to empower those who've gone through the experience of homelessness and houselessness in the city to help inform what the services need to look like in terms of making sure that our approach as a municipality is accountable and delivering on the promise of a human rights approach to housing supports. There was also recognition in this report about the overrepresentation of Indigenous people and persons experiencing homelessness in our city. And this report recognizes that we need to not only acknowledge that a one-size-fit-all approach isn't going to work, but that we actually have some work to do specifically around Indigenous homelessness. And I wanted to say through you, Chair, if there's anything that staff are able to comment on now, or if there's work that we can anticipate coming forward to this committee in response to that.
So through the chair to the council, it's absolutely a top priority in terms of making sure, both through a EDI lens, but also some of the priorities that we have with the engagement approach, to make sure we have the voices at the table. It's about building solutions, and the solutions can only really be placed in merit if they understand the complete narrative that needs to be put in place when we have those discussions. So absolutely, we'll continue to monitor that and bring back those experiences that we are bringing and responding to as we go through this process, and the engagement piece, which will continue to be in front of this committee, and its focus on a housing first. So much of this transition out of the pandemic, as you can imagine, is anticipating the solution of housing many of our unhoused individuals within our community, and what that will be in terms of both an approach, but also as a funding mechanism to ensure we reach those priority groups.
Much appreciated, and aware of my own time limit. Last question is around Principle 6, which is to ensure encampments meet the basic needs of residents consistent with human rights. And it's come up quite a bit about the city not necessarily setting up temporary resources on site, i.e. washrooms and running water, because it's physically not feasible. But that efforts would be made to connect individuals to nearby resources. And there's been much concern in these winter days about where folks are being able to go to access those hygiene facilities. So last question is just if there's any update there in terms of our winter hygiene facility strategy moving forward, as this committee had passed a motion at the end of last year to address that issue.
So through the chair to the council, we continue to support and actually fund additional agencies that provide much of that gap that exists because of the pandemic with respect to access to sanitation and hygiene facilities. We use our engagement as a way to communicate where they exist, as well as when they are available. And we continue to explore, both through our community partners and agencies, opportunities to expand on that. As you may be aware, we don't have any sanctioned encampment sites, and so the approach is not to necessarily build the infrastructure there, but to be able to flexibly advise and coordinate where those opportunities exist, recognizing that we've had our challenges in the past with a number of those items. So we continue to be flexible on that piece and seek out those opportunities. But at this point, with our engagement, it seems with a number of our drop-in agencies, we seem to be having some success in that respect.
Thank you so much. And thank you to all the staff who were involved in putting this report together. I know it's not always a priority to put forward policy-based analysis work like this, but I think that it was critical and important. And I can definitely see how these principles are coming into action in our local approach, and hear very clearly the commitment from Housing Services Division that is an ongoing effort to refine our approach moving forward. Thank you so much. I'll take back the chair. We're moving on. Oh, we have to vote to receive the report. And that's carried. Moving on to item 10.7, Indigenous Strategy Implementation Plan. May I please get a mover and seconder so we can put this on the table? Moved by Councillor Clark, second by Councillor Pauls. Any discussion on this report? Seeing none, put it to a vote. Moving forward to item 10.7. Oh, that carried. Thanks for reminding me. 10.7 updates to the emergency plan. I understand that General Manager Johnson would like to make some introductory remarks. But before we do that, if I could get a mover and a seconder to put it on the table. Moved by Councillor Jackson, seconded by Councillor Marula. The floor is yours, General Manager Johnson.
Yes, through the chair, I just wanted to say a couple of words of thanks to the team that is in parallel with running the largest and longest emergency operation in the city's history. There is the important due diligence work that is required provincially and through obviously a good approach to emergency management locally, and that's what's here before you today. It's our ongoing work. This would have come naturally as a work of looking at our emergency program, and it's happening in the middle of an emergency operation, which always is a little bit strange. So I just want to let you know this has nothing to do with how we're responding and whatever. We're constantly looking at ways to improve our ongoing emergency response. But this is the really important work that happens day in, day out in this department. And it starts with the leadership of our fire chief, who is well versed, of course, in emergency management and emergency planning. But I want to say a special word of thanks to Connie Verhage and Kirsten Marples, who are the two people that, as I mentioned in our budget presentation, get up every day thinking about emergency management in this community. So there are a few minor tweaks. The staff are here to answer the questions that you may have about this. This is a piece of work that needs to be done in order to keep us current with our work. But I'll also tell you that through this pandemic, we have learned a lot that will go into, I think, some more robust changes for next year. So next year at this time, you may see an even different tweaking of our emergency response planning, because we've learned, quite frankly, through the real execution of emergency management over a long period of time, some of the things that we need to be tweaking as we go forward. But main reason for the comments was to thank our incredible team for not only helping us through a current emergency crisis management scenario, but also doing the important behind the scenes work on a policy front and legislative front to ensure that we remain current in our capacity. So thanks to those folks.
Thank you for those comments, General Manager Johnson. Councillor Clark.
Thank you very much. And I'm just I was reviewing the bylaw, but I was having challenges trying to find what has changed. So is anything that's underlined changed, or those are just the references?
Through the chair, I'll have Connie jump in and answer that question. Connie?
Yes, hi. Through you, Chair. So some updates were done to the EOC management team. So we added in the city solicitor, which was not on the previous plan dated in 2017. So that was added to the EOC management team. We changed the title of the Director of Communications and Intergovernment Relations. That name had changed. And we had changed the IMS structure, and we condensed some of the units. That being the procurement and the supply unit were changed, and we added a PED to the operations tables. So those were changes that we felt needed to be done, and hence rescind the old bylaw and update to the new bylaw. Nicole is also on, so she helped us work through this process. So those were the changes.
So those seem to be mostly housekeeping changes in terms of who's on the committee, who's not. And
that's correct.
But in terms of the substance of the bylaw, I couldn't see any real changes. Were there any?
The bylaw mentions the membership of the EOC management team, and it mentions, yes,
okay.
So that needed to be changed. So that's what's in there. It's just the housekeeping, that's all.
Thank you. That's all I needed to know. Thank you very much. Appreciate it.
Okay.
Thank you, Councillor Clark. Thank you, Connie, for those answers. And seeing no other speakers, thank you to all the staff who've been serving on the EOC during this pandemic. And as General Manager Johnson said, the longest EOC operation in the history of our municipality. And you all have been showing up consistently and regularly to carry us through and to have to do this emergency plan and on top of it, I just wanted to acknowledge that labor is still ongoing, and we definitely appreciate it. Thank you. And moving to the electronic vote to please approve the recommendations that are in the report before you. That carries. Moving on to item 10.8, Red Center licensing inspection and program update. May I please have a mover and seconder to put the report on the floor? Moved by Councillor Paul, seconded by Councillor Marula. Any discussion on this item? Any questions on the report? Seeing none, we'll move to an electronic vote. That carries. Moving on to item 10.9, adaptation and transformation of services for people experiencing homelessness, update number 2. May I please have a seconder and mover to put the report on the floor? Moved by Councillor Jackson, seconded by Councillor Clark. The report is on the floor, and I see General Manager Johnson is available. Pass it over to you, General Manager Johnson. Did you want to make some comments?
Thank you. And through the chair, this report and the next report, are arriving late in the day. You just got them yesterday as part of the amendment package. The two reports, so I'll talk about both of them at once. The first report you're looking at, we do need to amend the investment that we're making to our temporary shelter. It doesn't change the original pieces that you approved, but in looking back at the former report, you approved an upset limit, which in hindsight was probably not smart on our part because it was an estimate at that time. And so we were required to come back and let you know that those costs will overrun the upset limit. The good news is that none of this will impact the levy. So these are resources that will be allocated through the Social Service Relief Fund and the Municipal Reserve for COVID. So no hit to the net levy, and it is really to allow us to expend resources that we had underestimated at the time that we were transitioning from First Ontario Centre to Cathedral. I did want to draw attention to one piece that's in the report that says we are examining what beyond June looks like. And so rather than get into any of that in this report, this simply allows us to pay the bills that we need to Good Shepherd Centers. We will be bringing back, and I expect it will be in April, the first meeting in April, a plan that looks at what we need to continue beyond June 30th of 2021. The second report is allowing us to receive money. And as you know, we get these from time to time. And because we have to expend the money by March 31st, we wanted to bring this as quickly as we could so that you would give us the authority to receive money so that we can invest it again in services that support high need individuals. And in this case, this is this high acuity piece we're trying to get to. These are mental health and addiction support dollars. So again, I'm jumped ahead to a report that's not quite on the floor yet, but I thought I'd do it 2 in 1 so I don't have to pop back up on your screen. And I appreciate your consideration, but did want to give you assurances that this does not impact the net levy in any way. So we didn't slide one through quickly to try and usurp a budget process here. It's simply so that we can continue to do what we need to do in the homeless sector.
Thank you, General Manager Johnson. Open for questions from my colleagues. Don't see any. I did have a question and / comment, so I'll turn the chair over to Councillor Clark.
Absolutely, go for it.
Thank you. I noticed. Sorry. To catch you right in the moments of taking a bite after chairing AFNA. Through you to staff, so just clarifying that the report spoke to about $450,000 in estimated cost versus projected cost versus actual cost. So this is covering those actual costs. Really glad to hear that there's a report coming in April to look at post-June what we're going to be doing. Definitely the concern in the community about what do we do when we lose the funding to maintain the hotel spaces and surge capacity in our shelter system, and what does that funding formula as well as action plan look like in terms of moving people from emergency supports for housing towards that path that we're all committed to here, which is permanent housing. So if I could, through you to staff.
So through the chair, one of the big questions we have is, how do we keep people focused on it's not just the emergency, the crisis that we're in now, but that we will need some period of transition. And then I think there's an additional piece on top of that that this committee is well aware is that we have not received any significant increase to the funding from the province that allows us to fund a lot of homelessness and what I'll call more the transitional housing opportunities. It's affectionately known as the CHIPPY fund. It's that consolidated homelessness funding. So we have two challenges before you. One is, to keep the pressure on to remind the federal and provincial governments that COVID-19 with a vaccine strategy might start to wane in terms of its impact in cases. It's not going to wane in terms of its impact to many services and vulnerable populations. We're likely a good year to 18 months in terms of a transition from today. So we're going to need that resource, and we want to give you the chance to look at it across all the sectors. So again, today was to clean up some things that we probably should have just worded differently in the original report to give us the flexibility to invest what we needed to. But post June, I don't see any need. I don't see anything pointing to the fact that we will need less hotel rooms, that we will need less of our drop-in programming that we just talked about earlier in answer to a question. Our outreach work that is happening and our increased shelter investments around PPE and all the other things. So, we have a lot of runway left where we will need to work through that transition. And the other piece is by bringing this report forward, you'll also get a sense from the staff's perspective in terms of how we see that transition happening. The other piece is at some point, hotels will want their rooms back. And we have to be cognizant of the push-pull that will happen here. The reason that they're so available to us is there are very few people in them at the moment from the general public. So there's a lot that's going through our head that has nothing to do with the crisis at the moment. It has to do with what does this look like moving forward. And the final piece I'll put in is I think that we should have a conversation as a committee, and we will be encouraging your support to continue to remind people that the way we've been able to address issues of homelessness, and I think do some pretty interesting things even in a crisis, was because we had an investment that allowed us to do that.
Exactly.
And how do we keep some of that investment going forward so that we can continue to meet the needs in this case? So yeah, I didn't want to equate today as being part of a choppy approach to that go forward position. Today is today, so it's just till June 30th, and then we'll look at what happens with this committee well in advance of that deadline, which will be good as well.
Thank you. I appreciate it and look forward to the ongoing discussion. It's been very clearly expressed in terms of those who are already needing home housing supports versus those who we have yet to see that will need those housing supports as the pandemic has had impact on people's economic stability in ways that some of us have been paying attention to and responsive to and raising at the council floor in terms of recent reports from public service personal support workers who are no longer able to pay their rent, as well as make really hard choices between rent and emergency food, needing to access emergency food networks, really struggling and seeing some of those essential frontline workers turning to shelter and low barrier housing and supports at a time where their labor is so essential from a public health perspective. So more work to be done, and thank you for staff's leadership in making sure that these funding pieces get on the table and approved in a timely fashion for us to move on. Take back the floor. The report is before committee for approval on item 10.9. Thank you. And Councillor Pauls, if you could just indicate. That carries unanimously. Moving on to 10. Ministry of Municipal Affairs and Housing, Mental Health and Addiction Funding. This is 302,208 provincial funding towards mental health supports and addiction funding. I'm going to mover and a seconder. Moved by Councillor Parles, seconded by Councillor Marula. The report is before you for consideration. No speakers, so the vote is up. Coming up. Excellent. And that carries. Moving on to item 10, motions. There's no motions on the agenda. Item 12 is notice of motions. Are there any notices that committee members would like to present? Seeing none, moving along to item 13, general information and other business, including the outstanding business items list. Any comment from colleagues? No, moving along. Oh, do we need a vote on 13? Yes. Moved by Councillor Clark, seconded by Councillor Jackson. OBL list in front of you. To be approved. Carries unanimously. Now we have our private and confidential closed session minutes to approve. May I please have a mover and seconder to approve the closed session minutes of December 10, 2020. Moved by Councillor Jackson, seconded by Councillor Marula. We'll have an electronic vote. Please indicate your vote now. Wonderful. Councillor Pauls, we just got to get your vote in. There we go. And carries. Moving on. Favorite agenda item, folks. Adjournment. May I please have a mover and seconder? Moved by Councillor Clark, seconded by Councillor Pauls. Electronic vote. And while that vote is going forward, wishing you all
Excellent
a good
job, Chair. Excellent job.
Thank you. Oh, it's now I'm tying up the vote. Hold on. And that carries. Have a wonderful afternoon and see you at GIC tomorrow.
See you, and thank you.